Welcome to week 3 of medical law. This week we're going to talk about licensing in the medical practice. The government regulates the medical profession through the licensing system. You'll also learn about some of the circumstances under which licenses can be granted or revoked and the responsibilities that come with possessing a license. When a license is revoked, that means that it's taken away, which means a medical professional, is no longer able to practice anymore because they've lost that license for something that they have done. We'll also talk about the role of the licensing board, mandatory reporting by the medical profession. We touched on that a little bit last week in week 2, mandatory reporting regarding abuse. The Uniform Controlled Substance Act and medical malpractice insurance. We talked a little bit about malpractice in week 1, so we'll talk a little further on malpractice and what some reasons are that someone what they have done to create malpractice for themselves. The statutory guidelines of each state make it mandatory for physicians to submit a report on a regular basis to different government agencies. It's mandatory for physicians to provide reports of births, deaths, and communicable diseases. Births, deaths, and communicable diseases. In most states, practitioners will be charged with misdemeanor if they fail to report, violent deaths, deaths caused by criminal abortion, deaths occurring in the absence of the physician, deaths occurring after an unexplained coma, medically unexpected deaths occurring during the treatment, deaths of a prisoner at a penal institution, and deaths of those whose bodies would be unavailable for a pathological study, like someone who was cremated or buried at sea or something where we cannot see or ascertain the body. Most malpractice suits that involve drugs involve the abuse of medical prescriptions. The Uniform Controlled Substance Act was enacted to bring uniformity in drug handling across the United States. It restricts the distribution, classification, sale, and use of certain types of drugs. Most of the states in the U.S. have adopted this act and they use it. When someone in the medical office is not careful in dispensing prescriptions, they may end up with a malpractice suit. Having malpractice insurance has become a necessity for healthcare professionals today. So that's really important, having that malpractice insurance. Any litigation is expensive, and over the years, the damages awarded to plaintiffs have risen dramatically, and that malpractice insurance would take care of those things that happened because a healthcare professional was sued. Usually, a physician's insurance covers the healthcare professionals and is a part of their employee benefit package. So that's really important. The physician's healthcare insurance covers the healthcare professional as well. In some cases, depending on your position, having separate insurance also has its benefits. Usually, medical assistants are going to be covered under the physician. We also will talk about the Equal Employment Opportunity Commission, the Occupational Safety and Health Act, the Medical Waste Tracking Act, the Family and Medical Leave Act, the American with Disabilities Act, and the Fair Labor Standards Act this week. Medical records are really important, and they contain information on every aspect of treatment given to the patient. They are legal documents. Medical records are legal documents. And what has transpired between the physician and the patient are going to be included in the medical records. So we also will talk more about medical records, type of medical records, ownership, patient's access to medical records, and the medical records as evidence, and the capacity to consent to release of information, altercation and fabrication of medical records. We'll talk about that a little bit more in depth. I really encourage you to start posting early in the discussion and post often, because it really gives us a chance to really have a time to really respond back and forth to each other. I also encourage you to respond to the things that I post to you in each discussion, and I will make sure that I post to everybody. We will be utilizing the big blue button so that we can have live discussion. I will let you know when I will be there to talk with you on the big blue button, and I encourage you to come and attend and spend some time with me as we review the content and we talk about some current events. I also will post at least one current event each week in the weekly news forum, and if you can and you're looking to enhance the discussion, I encourage you to respond to and comment on that weekly current event within the discussion for that week. Okay, I hope you all have a good week, and I look forward to working with you this week. If you need anything, please remember I'm always available. You can call or text me at area code 773-331-6574. Have a good week.